Okay, number 2, discuss and take appropriate action on Central Health's preliminary fiscal year 2014 budget. And that's you now, right, Jeff?
I think Mr. Wallace is going to open up.
Okay.
Yeah, Russ.
Thank you. Yeah, I want to make some comments about this budget, and I'm going to give you a list of items that really are going to be reflected in the budget that Jeff's going to present. First of all, the budget implements the will of Travis County voters that we heard through the election. This budget focuses, as always, on the core mission of Central Health. The budget puts into practice the first full year of operations for the Community Care Collaborative that will jointly manage and reform the current healthcare delivery system into an integrated delivery system. And we will be bringing you a full financial budget for the CCC at a later meeting. The budget provides funding for new enhanced healthcare services to the community through district projects. The budget complies with HHSC regulatory changes in the IGT flow of funds. The budget provides funds for healthcare service delivery expansions that will be administered and approved by the Central Health Board of Managers. This budget utilizes prudent reserve levels and the flexibility to leverage available matching funds in addition to accommodating the unpredictable nature of the IGT process. And also this budget provides funding for Phase 1 renovation for the Southeast Health and Wellness Center that will bring expanded access to the community. With that, I'll give it to Jeff and Juan.
Anytime that you do a list, you wonder if you've gotten it complete. The neat thing is that we want to make sure we've been listening to you as we prepare the priorities, but the neat thing is that this is your opportunity to make the budget truly your budget. So if we've forgotten something in that list, this is the time that we can still add it on. The one item that's missing, which Larry alluded to, is the CCC budget. I don't want you to think that we hadn't gotten it together for you because we've been too busy. Actually, we have needed to make some decisions before we could move forward with that budget. And primarily, later on in the agenda, you have the MOU, which gives us the final direction on how to treat the money that eventually go to UT, which will be reflected in the CCC budget. And we'll bring that budget to you within about a week or two.
Yeah.
And that'll give you the complete picture of how all the funds will flow and all the funds that you'll be approving for this next fiscal year.
So I'm going to walk through the proposed fiscal year 2014 budget for Central Health. And again, just to reiterate what Juan was talking about, this is a year in Central Health that we have a lot of change. And hopefully in my presentation, I capture some of those changes. And also, as he mentioned, there'll be a lot of activity in the Community Care Collaborative budget that we'll be presenting in a few days to the board. But the intent, again, is to show the complete picture. So this presentation is for the 2014 budget for Central Health. And just kind of looking at our presentation overview, I think we've set the context for the 2014 budget. And as I was alluding to, we certainly want to have some comparative data, both related to the 2013 and 2014 budgets, but also some of our previous presentations. We also want to discuss the use of the additional tax revenue. We have been before the board, the Central Health Board, and we've been going through at our Budget and Finance Committee meetings some proposed changes related to the reserve policies of both the contingency and the emergency reserves. So we will walk through that in detail. We'll review some of the 2014 policy issues, recap some of the changes, and talk about next steps. So I think that we've then talking about setting the context, a couple of other things just to mention related to Central Health as it relates to the 1115 waiver. We are the anchor entity related to Region 7 in the RHP plan, and we've worked with numerous stakeholders to really try to maximize the transformation of the healthcare delivery system throughout our region. And then in addition, for Central Health, we also had a successful tax ratification election, which the voters entrusted us with a 5-cent increase to make some transformative changes related to the delivery of healthcare. With Seton, we've established a governing framework to carry out the waiver projects, provide integration and joint management of the delivery service, health delivery service, and plan for a continuing transformation through the creation of the Community Care Collaborative. So we've certainly taken all of those into consideration, and we have to implement the will of the Travis County voters. Getting to some real high-level differences in our healthcare delivery expenditure budget, which is the primary expenditure related to Central Health. This slide compares the 2013 and the 2014 preliminary budget. So I'm just going to walk through some of the line items. In 2013, our approved budget, although we had numerous intergovernmental transfers that we transacted throughout the year in 2013, we only budgeted for the private uncompensated intergovernmental transfers. Due to regulatory changes, we are now budgeting for all both UC transfers, uncompensated care transfers for both private, as we previously had, and public. And then in addition, we'll be budgeting for IGTs related to the disproportionate share IGT. And then on top of that, we have the Deseret projects that are new. This is our first full year of demonstration year 2 IGTs. So there's a lot of IGT activity, and you'll see a detail. We have a slide that shows some of the detail of that. In 2013, all provider contracts were in the Central Health budget. In 2014, ATCIC and Planned Parenthood will be the only main provider contracts in the Central Health budget. The remaining of those contracts will move over to the Community Care Collaborative. Eligibility and medical management, no change. And then there are a few items that were not in the 2013 budget for Central Health that you'll see in the 2014 budget. And those are the 3 items you see listed here. Community Care Collaborative payment from Central Health to the Community Care Collaborative. A transfer to the capital reserve, and this is a budget. This is a transfer for budgeting for phase 1 of the Southeast Health and Wellness Center, and then an appropriation for of a contingency reserve. Approximately $63 million of primary and specialty care provider contracts will be over in the Community Care Collaborative in the 2014 budget. The additional tax revenue, again, as I mentioned earlier, the voters approved to increase our tax rate to 12.9 cents per $100 valuation. And so as the appraisal district goes through all of the valuation process, this rate increase means that Central Health will receive an additional $59 million related to property taxes from the previous year. And you'll see down at the bottom, we've outlined how we're spending that money. $44.4 million will be spent for intergovernmental transfers related to the 1115 waiver Deseret program, and then 15.2 will be a direct payment from the Central Health budget to the Community Care Collaborative related for direct healthcare services. This is a graph that shows fund flows as it relates to the Central Health DESRIP projects that Central Health is funding as it relates to projects that the Community Care Collaborative and Seton and Dell Children's are performing. So let me walk you through this a little bit on how the funds flow and what it means from a valuation standpoint. So up in the upper left-hand corner, you see an intergovernmental transfer of $44.4 million, and that comes from Central Health. So that's the budget that we're talking about in fiscal year 14. This is the intergovernmental transfer, or local funds that are sent to the federal government for a federal match. And as a reminder, the DESRIP projects are projects that are performed based on metrics and outcomes. And so it's not like a grant or anything that this is something a little bit new where we're actually performing projects and achieving what are called metrics and milestones and outcomes before we get paid. Nonetheless, once those are performed in these projects, there's an intergovernmental transfer that Central Health will fund. It'll go up to the federal government, and it will come back to one of the actually 3 performing providers, and I've lumped Seton and Dell Children's as one performing provider. But the performing providers are the entities that perform the projects or that contract with other entities to perform the projects, but they're the entities that are on the hook for DESRIP project performance. So you'll see that of the $44.4 million, there are 14 DESRIP projects in the Community Care Collaborative, and there are 16 projects in the Seton or Dell Children's DESRIP projects as performing providers. Of the 14 projects, the valuation in the Community Care Collaborative is $59.5 million, and in the Seton Dell Children's it's 49.6. So the emphasis of this graph is that as it relates to DESRIP projects and the IGT process and the matching processes, we're spending $44.4 million in intergovernmental transfers, and for that we're getting 30 projects that result in a valuation of almost 110 million, it's 109.1 if you add those two amounts together. So there's a lot of leveraging of funds to provide services and to our community related to improving the healthcare delivery system. The next 2 slides show what these enhanced services are. This is a listing of the 14 projects related to the Community Care Collaborative. I won't go through them all, but I will point your attention to one project. If you recall, we had one project that we withdrew related to care expansion. The process is dictated by HHSC is you can replace a like, so-called like-kind project or like-value project. We have elected to do that. We've replaced it with a patient navigation for our integrated delivery system, and you'll see that it's the first bullet under navigation. So we're working on submitting that project within the next few days, but that's our replacement project for that. But these are the 14 projects that enhance services for our community as it relates to the Community Care Collaborative, and we've kind of grouped them up in categories. So we're really excited about performing those. There's a lot of work involved in them, but they are really turning into transformative projects. This next slide shows the projects related to University Medical Center at Brackenridge. Again, there are 14 projects that they're performing, and then the last 2 are Dell Children's, the care for chronically ill children, and Family Center Pediatric Obesity. So getting into a little more of a comparison of prior year and current year, looking at sources of funds or revenues. So we're looking at 2013 and fiscal year 2014. As I mentioned, property tax revenue is increasing from $80 million in 2013 to $139 in 2014. Our lease payments are increasing slightly to $32.3 million. Interest revenue, we're increasing, well, we're doubling it. It really wasn't a whole lot there in the first place, but we're doubling our budget thanks to rates going up a little bit. Tobacco litigation, we had $1.9 million budgeted in 2013. We received approximately 1.6, was it 1.4? Okay. So we've been a little conservative in 2014. We've lowered that to 1.2. We're going to look at that. Our contribution from contingency reserve in fiscal year 13, the approved budget was $4.7 million. And as you recall, we came before the board and we had an approval of a budget amendment for $25 million. So that takes the amended budget up to $29.7 million. And you'll see in 2014 we're proposing an amount of $44.6 million, and we'll go into a little detail on that. And then the last item is the Sendero Reserve. Last year we did not draw from our reserve amount. This year we're proposing $2.2 million. And just kind of as a reminder, we've set aside a reserve of approximately $15 million. So this is drawing from that reserve of $15 million, an amount of $2.2 million. Okay, on to our healthcare delivery budget, and this is what's called a use or an expense. And this is, again, where the most of the central health budget has been, and certainly in 2014 it is. We have two programs, healthcare delivery and administration, and again, this is by far our largest program. So we'll go over some of this in some detail. You'll see the intergovernmental transfers. We presented an amount on July 10th of 122.3, and that number remains unchanged. On our provider contracts, on the 10th, we initially presented an amount that represented just the ATCIC contract. Where we're at now today is we're presenting an amount that's the ATCIC contract plus Planned Parenthood. The Planned Parenthood contract is $400,000 contract, so that's the increase. Eligibility and medical management changed slightly. Our payment to the CCC has decreased. It's gone down by about half, and you'll see down below, you'll see three items that basically make up that difference. You'll see a service expansion, a transfer to capital related to the Southeast Health and Wellness Center, and the Seton Charity Care. We initially, in our presentation on the 10th, had included those amounts in the transfer, and we're a little unsure where those items were going to go. We've landed that these items are going to go in the central health budget, and so you'll see those in the central health budget, which means we're decreasing the amount that we're sending over to the Community Care Collaborative as a direct payment. So you'll see the Sendero reserve amount is unchanged at $2.2 million. And then the contingency appropriation, we've had a lot of discussion on that, and we're bringing forward an amount, an appropriation of $44.6 million that brings the total healthcare delivery budget up to $210.6 million. So it's higher than what we had presented, primarily due to the contingency appropriation. In the healthcare delivery budget, the intergovernmental transfers, this is a breakdown of the components of those transfers. You'll see UC stands for uncompensated care, so you'll see private uncompensated care of 27.9. The UMCB, or what's called public uncompensated care, plus the disproportionate share intergovernmental transfer of $50 million. And then, as I mentioned, the DESRA amounts are new for this year as it relates to a full year. So you'll see $20.2 million of DESRA intergovernmental transfer amount, and then 24.2 for the CCC, for a total of 122.3. I had mentioned the Southeast Health and Wellness Center. We are in the Central Health budget. We have a $4.5 million amount, funding amount for what we're calling Phase 1. The emphasis of Phase 1 is to renovate the former VA clinic, the Health and Wellness Center, with an emphasis on providing services to the community as they relate to DESRA projects. And those primary areas, those areas are primary care, specialty care, dental, and patient-centered medical home. So the total budget for Phase 1 is $8.2 million. We're proposing that we utilize $3.7 million in existing reserves, and again, that Central Health would fund $4.5 million for that amount, for a total of $8.2 million. Our administrative budget is relatively unchanged from our previous presentation. Again, this is the smaller of our two programs. It's gone from $9 million to $9.1 million. And again, the changes relate to the 1115 waiver and related to the CCC and the master agreement, some costs. We also had salary costs related to proposed pay for performance, and then we had some benefit increases as it relates to primarily to health insurance. So we talked about changes to our reserve policies, and we're going to go into some detail, but this is kind of the summary slide of what we're proposing. So we're not proposing a change to the use of them, of the emergency reserve, which is used in an unusual circumstance. But what we are proposing is changing the percentage of expenditures from 33% to 15%, which, if you're looking at it in days, equates to from 120 days to 54 days. And so this is the calculation that we're using for 2014 to calculate the funding, or the funding level of the reserve as it relates to the 15% amount. So we have total budget uses of $220 million, and then we subtract out our contingency appropriation and our Sendero reserve amount of $2.2 million, which comes to a base budget appropriation of $173.2 million. And then we take that amount and we multiply that times 15%, which gives us $26 million. So that's the funding level that we're recommending for the emergency reserve at 15%. So what that means as far as our current existing balance is we have a current ending balance of $37.3 million. And so if you take that amount and subtract out the 15% level, we are proposing to the board that we transfer the remaining amount of $11.3 million to the contingency reserve. Our contingency reserve policy for one-time or ad hoc expenditures may be used as part of a plan for structural balance, and there's no prescribed amount. The part at the bottom that's bolded a little bit is a proposed change to that policy, which states that it may be used for contingent appropriation to provide flexibility for timing and other issues during the 11-15 waiver period. We've talked at length at our meetings, and I think we spent some time at Budget and Finance talking about the unpredictable nature of our intergovernmental transfer process. You know, the waiver is a new program. There just have been a lot of unknowns. I think just regulatory speaking, but certainly timing from a intergovernmental transfer side of it, or IGT side of it, has been very unpredictable, and budgeting on a fiscal year basis has made it extremely difficult to predict budgets on that. So again, as we walk through the contingency reserve policy, the emphasis is flexibility, knowing that we're trying to maximize our funding as it relates to our programs related to the 11-15 waiver.
So Jeff, what we're saying here with the $44.6 million that we're allocating in the budget for 2014 is that we may or may not expend those dollars in 2014.
That's
Correct?
true.
Okay.
We are appropriating that amount, which means you could spend it all.
Correct. Okay, thank you.
It's important to keep in mind that we don't intend to spend it down. As we get through the end of the tunnel, we expect to have replenished those funds. So the difficulty is predicting the cash flows and all that, but we do expect to preserve them.
So the need for the contingent appropriation, just kind of getting to that very point, is just the substantial delays. Again, we expect those delays and unpredictability to exist in 2014 as well. Importantly, on the last bullet point, and again, we expect to replenish those amounts in subsequent years. So this isn't a one-time, you know, we're not looking at these as one-time. We're looking at trying to maximize our funding, but we're also looking at replenishing the fund over time in subsequent years.
Excuse me, just to clarify so I understand it. So we will be replenishing them as we meet the metrics of the district projects? Is that?
No, what we're doing is because of some of the timing of things, we're trying to maximize our funding of IGT, but over time, our transfer to the CCC may vacillate a little bit as over time. So I guess I kind of look at it as there are a couple of moving parts, and you may have some timing differences on one part that result in some fund flow decrease on the other side of the moving piece. So
replenishment happens when money ends up in the CCC that is a blessing, and we
Yes.
don't have to put it in directly.
yeah,
and
that's
therefore
that's
it goes to our
a
bottom
that's
line.
a
Exactly.
much better way of saying it
Yes.
than I was. You're right. So again, it's about trying to leverage in our funding, and so there may be some times where we may need to spend that down, but in subsequent
We'll be
years
doing that.
we would be doing that,
With
and
an
then we would
expectation
replenish
that
that.
The flow of funds would result in us saving
Yes.
that money at a later time.
That's correct.
Okay.
Thanks.
And so this is a calculation of our contingency reserve, where we stand as both ending in 2013 and then where we expect to be in 2014. So our approved ending contingency reserve per our approved budget in 2013 was $38.3 million. We came forward for a budget amendment of $25 million, which brings the amended balance to $13.3 million. We expect, related to 2013, related to our budget, and again, the contingency reserve is kind of when everything falls to the bottom line, it falls into the contingency reserve. We expect to replenish $20 million of that $25 million amount this year. We also propose in the emergency reserve an amount taking the reserve level to 15%, of $11.3 million, moving from the emergency reserve to the contingency reserve, which brings the total to 44.6. So that's the request we have in 2014, is to appropriate $44.6 million in our contingency reserve. 2014 proposed budget changes. Again, our tax rate is increasing to 12.9 cents, and just kind of rounded numbers, 12.77 cents are related to the delivery of healthcare services to our community, and 0.13 cents per $100 valuations related to debt service. In previous years, we had only budgeted for private uncompensated intergovernmental transfers. Now we're budgeting for all types, including the new DESRIP, full year of DESRIP. And then again, a large amount, over $60 million of Central Health contracts for primary and specialty care that had been in Central Health will be moved over to the Community Care Collaborative. Next steps, we're here tonight, August 21st, presenting to the board. We have a time slot with the Commissioners Court on the 10th to present the preliminary budget. We have I think item 3 relates to the public hearings. One scheduled on the 29th and one scheduled on the 4th related to a hearing on our budget and tax rate. September 11th, we would come back to the board for adoption of the 2014 budget, and then the 17th or the 24th, we would go over to the Commissioners Court for final approval. And then I know we talked in the opening about a complete picture of both Central Health and the Community Care Collaborative, and I apologize, we're still working on the schedule as we speak, but we expect to have our first preliminary presentation to the Community Care Collaborative Board of Directors on the 27th. We expect to have a presentation to the Central Health Board of Managers shortly thereafter, and we expect to have a presentation to our Budget and Finance Committee also. What we'll try to do is we'll try to align this process as close to the Central Health budget approval timeline as we can, again, to provide our board with a complete picture of both Central Health and the Community Care Collaborative budget.
I have a question over here.
So that the presentation to the Central Health Board of Managers would possibly be the first board meeting we have in September, or would it be a special call?
I think we're going to talk about that here in the...
We are actually going to talk about that in number 5.
A special agenda item.
Yes,
Okay.
yes.
Yeah.
Get all that outlined.
Yeah.
Okay.
Yeah, we're really, and I apologize, but as we have gone through the CCC, there's been a lot of unknowns, and so we're trying to align our budget process again, but we just haven't been able to, up until probably today, know with more certainty what those dates are.
Okay. Katrina, would you like to make any comments? I know this was
Yeah.
presented to the Budget and Finance yesterday. Was that correct? Would you like to make any comments on this?
Seems longer
I know.
ago, but yeah, I think it was just yesterday. Yeah, thank you very much. First of all, thank you, Jeff, for putting together such a well laid out and comprehensive presentation. We did talk about it extensively at the Budget and Finance Committee, and for me at least, I like that you have the numbers and the words and some pictures in here, because I think it really helps us understand how funds get routed around, because it's a little more complicated now. And you've made this point a couple of times, and I just want to reiterate it. I particularly like the page where you show the budget components and what we've considered in the past and what we're going to be considering in the future. And even though we talk about the majority of the provider contracts moving into the CCC budget, we still will consider the CCC budget on this board.
Yes.
So some of that detail that we're used to seeing isn't in this budget, but we'll still see the budget and approve the budget that does contain that detail as well.
It'll still be a real similar process
Mhm.
as it relates to the central health board.
Right, right. So, so anyway, so thank you. I think this, I like very much the way you laid this out and explained how the funds are moving as well as their purposes.
Thank you. Dr. Quigley?
Yeah, Jeff, again, thanks for a well-explained budget, probably about as well explained as we've had in the years I've been on the board. I think it's good you're showing where the new tax money is going to be spent and how we're going to spend it. I think it's good that we're clear on the IGT, with what is, we've been sending up before and now the district, and I never really kind of got a handle around that until now. I think it's a good use of the capital funds to do the south east hub. The budget gives us the flexibility that we kind of worried about for a while, and I think this is built in there now. And it shows how we're going to expand healthcare with the new money. And the changing the reserve policy is probably a long time coming, get more of that money freed up for healthcare. And so I applaud you and Juan and Rosie and Larry
Thank you.
for this great budget.
Other comments?
May I ask one question as a newbie?
Yes, and I was going to introduce you, but so now, Mr. Kirkendall, thank you so very much for joining us. This is our newest board member, and we welcome you here. And
Thank
so
you.
with that, ask away.
And I extend my sincere support and excitement to join this group and board as a new board member. I hope to be collaborative and cooperative, and I intend to be, I hope. And I look forward to working with each of you, including staff. One question, and obviously I'm on the uptake, but why is it that Peoples and Austin Travis County Integral Care are not transferring over to the CCC?
Planned Parenthood?
Yes.
Sure, sure.
Yeah, well, let me address Austin Travis County Integral Care first. They go through there's two answers to that. One is they use money that comes over from us as it relates to public funds. It qualifies as public funds, and they're able to use those funds to acquire some matches related to it, some state matches. So if we move that over to the Community Care Collaborative, it would lose that property. The second piece of that answer is they're also participating in an uncompensated care program. And again, it's the same answer though. They could not participate in that program if they lost the public funds property. So Planned Parenthood was really more of a kind of a policy decision. You know, you could have argued it could have gone in the Community Care Collaborative. It's something that we brought up early. I think the board has supported that contract staying in the central health budget. That's from a staff standpoint, that was what we proposed.
Thank you for that.
moving it forward.
And thank you for your time.
And Jeff, that's the direct funding that we provide currently to Planned Parenthood. But
that's
there's a chance that maybe the CCC would be paying Planned Parenthood for a district project if they were a contractor,
Absolutely.
correct?
Absolutely.
Okay, okay.
Absolutely.
I just wanted to say one more thing.
Yes.
I couldn't read my writing answer. I like the idea that we retain $5 million for expansion funds if we need it. We planned on 3, but 5 makes it even better. And I can see some things like Planned Parenthood and other things coming up through the year that we might want to spend a little more money on if the need arises. So, thanks for
Yeah,
doing that.
and again, the premise that we took on the budget was, let's go back to the base amounts. I know that we had some service expansion amount that we used this year, but we have some unknowns coming up throughout 2014, including the Affordable Care Act. So we took all the provider contracts back to the base amount, but we've increased the service expansion funds to allow the board to have the flexibility to designate funding to the resources as we progress through those unknowns,
That's where
the
my
uncharted.
That's where my elbow money was back in the day. Thanks.
Okay, Lynn?
Jeff and I'm not so sure where to look for the answer to this question, but I know there was a reason to increase administrative costs because of the additional demands, because of the waiver and all that. How much more is the administrative cost this year than the 2013 budget?
We were at
I just couldn't find
about
it.
$8.5 million in 2013.
So only about
And we're
600,000.
increasing it to 9.1.
Okay, thank you.
But you also mentioned at Budget and Finance yesterday that there was other costs and just that it's not all just administrative. What else was in there, Jeff? I'm trying to remember what you told us yesterday.
We're also, as it relates to administration, moving the tax collection piece.
There we go.
We had, in the past, that had just been a separate line item, so we're really
Yeah.
just moving it.
So although it
into
appears
that.
like it's a larger amount, but that, it's really not as significant because that was a separate line item.
Well, the 8.4, yeah, but that's kind of an apples to apples.
Okay.
So there is an increase in administration related to the waiver and the
Okay.
CCC, things
Okay.
like that.
Okay, other questions? Other comments? Okay, so staff is wanting some direction on this preliminary budget, and we need to take a lot of action on it tonight. So as you can see, it's broken out into 1, 2, 3, 4, 5, 6, 7 motions. So that's enough for every single one of you on here to make a motion. just saying, okay? But also, as you can tell, there are several of us that will have to abstain in some of these motions. So if there is no further questions, comments, discussion, we can start on motions.
I'll
Madam
kick it
Chairman.
off. Oh, unless you'd like to.
No, not yet. I will later, trust me. But for today, being new to the scope and breadth of the budget, I would respectfully like to abstain.
Okay, sounds good.
I don't know what I'm really voting on.
Okay, thank you. So with that then, yes, Lynn?
I'm not sure what's in the budget that's requiring people to abstain from. And I'm kind of confused about that. I know poor Dr. Cookwood has to abstain all the time, but I just
Yeah, I have
don't.
to, Seton and Community Care Collaborative and
So anything that has to do with that, but like the one about Texas Mutual Insurance or the TDI.
I abstain on anything related to entities regulated by the Department of Insurance.
I get that, Katrina, but there's not, where in the budget is there anything that has to do with Texas Mutual Insurance Company?
Well,
I mean, the budget that Jeff has just presented to us.
Well, within that specific item, that is a piece of our budget. There actually are, I believe, our workers' comp carrier.
Oh, okay.
And so we
okay. I
use
just-
those, yeah.
Oh, so it'd be under the
Yeah, you
administrative
won't
piece.
see, right, but you
Okay.
won't see like a specific item.
Okay. And then I was wondering for you, Chairman Mendoza, for ATCIC, why?
That would be under, let's see, page 10, mine would be under provider contracts, the 8.3.
Yeah, I guess maybe
We-
I'm not asking the question correctly.
Uh,
But
do-
probably
do-
it's not important.
No, it is, if you have the question, it's important. So
Why-
why am I abstaining?
Right.
Okay, because ATCIC is one of my clients.
Okay, thank you. Okay, I'm just sorry, I didn't know. I know Katrina abstains and I
Yes.
know.
Okay.
And Clark, you abstained?
Because Texas Mutual is a client of my
Okay,
law firm.
okay.
Okay,
Thank
Yeah.
you for that, your patience.
okay, no,
Thanks.
that's okay.
And just for point of clarification, some of these specific motions, for instance, the one relating to the Southwest University Physician Group, we don't see those particular line items in here because they're part of the broader healthcare delivery.
Correct. But at some point, Jeff, I mean, I guess in the others, will it still come like this? Because that's the way it used to come to us, the budget, right, in a total dollar amount? Or will we be
Right,
getting?
we will, by the end of this week, we'll be sending out our, kind of our transmittal, and then our, I'm just gonna call it line item budget.
There we go.
Although
Okay.
it's gonna be a little more summarized
Okay.
this
So we'll
time.
get more detail than what we have right
Yeah.
now, but we still need to approve this preliminary budget and still have to kind of separate, you know, where some of us, you know, had conflicts or, not true legal conflicts, but more ethical conflicts,
Mhm.
right?
Mhm.
Okay, there we go.
Mhm.
So, okay, so do we have all questions
Thanks.
answered? Any others? Okay, so with that, let's start. Yes, ma'am.
I'll make the first
Go
motion.
for it.
I move that the board approve the preliminary fiscal year 2014 budget relating to Seton Healthcare Family, Seton UT Southwestern University Physicians Group, DBA Austin Medical Education Program, and the Community Care Collaborative as presented by staff for presentation to the Travis County Commissioners Court and the public.
Okay, motion and a second. Any further discussion? All in favor signify by saying aye.
Aye.
And we have 2 abstentions, Dr. Coopwood. And for every other, we will have Mr. Kirkendall abstaining from every single one of these also. Okay? Okay. Next one. Yes, Dr.
I
Coopwood.
move that the board approve the preliminary fiscal year 2014 budget relating to Texas Mutual Insurance Company as presented by staff for presentation to the Travis County Commissioners Court and the public.
Okay,
A second?
have a motion and a second. Any further discussion? All in favor signify by saying aye.
Aye.
Aye. And we have 3 abstentions on this one. Treasurer Daniel and Manager Heydrich and Manager Kirkendall. Okay,
I move that the board approve the preliminary fiscal year 2014 budget relating to services provided by entities regulated by the Texas Department of Insurance as presented by staff for presentation to the Travis County Commissioners Court and the public.
okay.
Second.
Have a motion and a second. Further discussion. All in favor signify by saying aye.
Aye.
Any opposed? And we have 2 abstentions on that one. Manager Daniel and Treasurer Daniel and Manager Kirkendall. Okay,
Madam Chair, I move that the board approve the preliminary fiscal year 2014 budget relating to Austin Travis County Integral Care, also known as ATCIC, as presented by staff for presentation to the Travis County Commissioners Court and the public. And I respectfully request that perhaps our manager, Dr. Coopwood, would second that.
Second.
further discussion. All in favor signify by saying aye.
Aye.
Any opposed? And I abstain on that one.
Madam Chair?
Yes, ma'am.
I move that the board approve the preliminary fiscal year 2014 budget for items other than those related to the Seton Healthcare Family, Seton/UT Southwestern Physicians Group doing business as Austin Medical Education Program, the Community Care Collaborative, Texas Mutual Insurance Company, and services provided by entities regulated by the Texas Department of Insurance and Austin Travis County Integral Care as presented by staff for presentation to the Travis County Commissioners Court and the public. And all of the board can vote on that.
Oh, yay. Okay, so I have a motion.
I'll second.
I have a second. Further discussion? All in favor signify by saying aye.
Aye.
Any opposed? And 1 abstention. Thank you. Okay,
I further move the board approve adopting the Central Health Emergency Reserve Policy as presented by staff to set the funding level at 15% of annual expenditures to transfer from the Central Health Emergency Reserve Fund to the Contingency Reserve any amounts in excess of the 15% funding level and approve appropriating the Central Health Contingency Reserve within the healthcare delivery budget in Central Health.
thank you.
Second.
I have a motion and a second.
Can I just ask one
Yes.
question
Yes,
about
ma'am.
it? Jeff, I'm assuming that this decision about 15% is some industry standard that you felt like was appropriate.
Yeah,
And
we,
it's copied something.
yeah, we did look at like-kind entities
Okay.
and kind of took the higher level,
Just wanted to
and then
give
we
you a
looked
chance
at
to say
industry
that.
standards.
Okay.
And just to add to that, we had a detailed briefing at the Budget and Finance Committee that went into the reasoning and back.
Well, we did kind of a risk assessment. The way I would look at reserves is we looked at a risk assessment, and then part of our risk was what our funding streams were, and were they low risk or high risk, and I walked through a kind of a scenario. So I felt comfortable recommending that.
Thank you.
I do think we, at the last meeting, we approved a contract with, is it Cope? Which will, it's my understanding among the many things that they're gonna do, they're gonna help us sort of project out the 11-15 waiver and sort of where we would be at the end of the waiver period and so on. And once we get that information, I hope that we revisit the issue of our reserves. That's something that I want to be sure we planned for something appropriately. I know you're headed in that direction.
Sustainability is really important to
Right.
us to look at, and that's something we would expect them to help us with.
Okay, any other comments, questions? Okay, ready for a vote then? All in favor signify by saying aye.
Aye.
Any opposed? Okay,
Finally, I move the board direct the fiscal year 2014 budget to be set at the tax rate consistent with the November 6, 2012 tax ratification election at 0.129 on each $100 of taxable value of property taxable by the central health for the 2013 tax year.
okay. Can I have a second?
I'll second that.
Thank you. Further discussion? All in favor signify by saying aye.
Aye.
Any opposed? Okay. Thank you.
Thank you.
There you are. Thank you for the presentation. That was
Thank you.
very good, Jeff. Okay, number 3.
Number 3 is.
Let me read that
Oh,
version,
okay,
okay?
sorry.
Notify the public of the dates, times, and place of the public meetings at which the Central Health Board of Managers will present the budget and its associated tax rate to the public and accept public comments on those items.
So, item 3 is to set 2 public hearings. One on, excuse me, August 29th, and the second on September 4th at, here at Central Health, 1111 East Cesar Chavez Road, as it relates to the associated tax rate of 12.9 cents per $100 valuation, and to receive public comment related to our budget.
Okay, so the Thursday, August 29th will begin at 6 p.m.
Yeah.
And then the second hearing, which is being held on Wednesday, September 4th, will be at 5:30 p.m.?
Right.
Okay, and so we need a motion to that, is that correct? Yes?
Yes.
Sure. I move that Central Health hold 2 public hearings at which it will present the fiscal year 2014 preliminary budget and its associated tax rate to the public and accept public comment on those items, with the first hearing being held on Thursday, August 29th, 2014 at 6 o'clock. I'm sorry? No, 13. It's a 14 budget. You're right. That would be a long way away. 2013 at 6 p.m. at 1111 East Cesar Chavez in Austin, Texas, and the second hearing to be held on Wednesday, September 4th, 2013 at 5:30 p.m. at 1111 East Cesar Chavez in Austin, Texas.
Okay, have a motion? Can I have a second?
Second.
The second?
Discussion, Madam Chair.
Discussion, yes.
Jeff, did you present the associated tax rate in your presentation tonight?
Yes.
We
Yes.
approved it in one of our motions.
Yes. Thank you.
Yes,
Mhm.
and it was also in his presentation.
Right.
It was the last
In-
motion.
Right.
Let me
And it's just,
quickly-
and it's a little bit different, I think, than, and sorry, this is my first year, but this year we had a referendum a vote
Right.
that set the rate at 12.9 cents.
Thank you.
Mhm.
I was trying to see exactly what page it was for when we go back and look at it. But
It's the motion that Dr. Cook would.
yes, it was a motion also. Okay, okay, so I have a motion, a second, right? Where am I? Totally lost. Three, so we have a motion and a second, and we were in discussion. Okay, any further discussion?
Yes.
Yes.
And I'll direct this to Ms. Garvey. Do you have a overview of what information we'll provide to the public for them to comment on, seeing that we're looking at a week from tomorrow for the first public comment hearing?
Thank you. Christy Garvey, Vice President Planning and Communications. Good evening. Jeff and I will be working together to come up with the public presentation that'll be available and presented to the public. So it'll be a 10 to 15 minute presentation that will be available along with some accompanying documents with regard to the budget. And that will be available at least on the 29th, if not before.
Before that.
Okay.
And based upon prior feedback that we've gotten on several items, to the extent we can do that at the earliest possible date to give people ample time to look at it, instead of cramming the night before, that would be helpful. And I say that knowing what else is on both of your plates. There are competing priorities, and I would ask that Mr. Wallace would provide additional resources as necessary to support the early communication to the public to make that happen. Thank you.
Yep.
Yes.
And then I just want to add to that, though, so you're saying on the 29th, you're going to have a public presentation. Will that preliminary budget also then have the CCC budget in it? And
No,
will you make
this
that-
is only the central health budget. But we will, again, we have a public presentation scheduled on the 27th to the CCC Board of Directors.
And we're gonna, in the
Okay.
next,
And then-
we're gonna
and
talk
then-
about it
yeah.
in just a minute.
Okay.
Right.
Just, yeah, in just a minute,
I
we're gonna
see
talk
that.
about it. And we're gonna have another meeting
I
just for
guess what
that.
I'm questioning, though, we're going to have a public meeting before a special meeting, right? On the 29th? The special meeting on the 29th.
Well, I think we're actually gonna talk about that.
Yeah, we're gonna talk about that in just a minute right now, too. No, I understand, I know, but it gets a little confusing because there's a lot of pieces here, but we'll be talking about it in just 1 second. Okay? Okay, any other questions?
Just one other thought. I would encourage us to emphasize that the meeting, even though the date is a Thursday, emphasize it's a Thursday because people, the public in general, are very accustomed to us having meetings on Wednesday, so to overemphasize that it's on a Thursday.
Yes, well, I'd like to respond to the history on that. We have traditionally done our public hearings, held our public hearings on a Thursday and a Wednesday and at different times to accommodate folks. That's for the public's convenience in case Wednesday night is not a good night for them, that they could come on a Thursday night instead, and in case 5:30 isn't good, to move it up to 6 to give people a little bit more time to get here. So that's why they've traditionally been on Thursday and Wednesday. So that's been a long-standing tradition for the budget public hearings.
Okay.
We'll be sending out an email to our 2,500 list of constituents to let them know, I think tomorrow, about the public hearings and the budget and information, and we'll nail down when that information will be available and let them know in that communication. Yeah.
Okay. Okay, you ready for a vote? All in favor, signify by saying aye.
Aye.
Any opposed? Okay. Okay, now, number 4, discuss and take appropriate action on the Central Health meeting calendar, including rescheduling the August 17th, 2013 board retreat. Okay, so I talked to staff about this board retreat, and if it was necessary to have one between now and, we've got lots of meetings, and special call board meetings and public hearings, and we already have another retreat scheduled for October 26th. And so what we thought was most important is that we have a special board meeting so that we can get a presentation on the CCC budget. Okay? The best we can do here with this schedule and the meetings we currently have is the CCC board is getting a presentation on the budget on the 27th, which is next Tuesday.
At 2 p.m.
Okay?
Yes.
Do we have
And
time?
2 p.m.
2 p.m. And then we have a public hearing on the 29th, and then again on the 4th. But I thought it was important that we have, as soon as we could, after the CCC got their presentation, that we have a presentation of the CCC budget. And so I want to see if we could have a special board meeting for the presentation of the CCC budget on Thursday, the 29th. And that would be you would have the public hearing and the CCC presentation. Now, the public hearing starts at 6. So could we have the presentation of the budget prior to the public hearing? Is that possible for us to meet like at, how long would it take?
It'd probably be good to allocate an hour
Okay,
for it.
so is it possible to start maybe 4:30? What does y'all's calendars look like, and can we do that?
It's not following the public hearing, it's prior to the public
Mhm.
hearing. Okay, that makes so much more sense.
It's okay with me.
Yes,
What time?
4:30,
4:30?
yeah. And this one says to follow, but it's gonna be prior. It just all made sense once we were talking about this. Yes? Okay,
Yes.
so if that's a yes for everybody
I can't attend,
Yeah.
that's only one person.
at the same time? But you wouldn't even be, would you be here for the 6 o'clock? No? Okay, now this is another thing we're doing. So we are also having another presentation of the CCC budget on Tuesday, the 3rd, to Budget and Finance.
Great.
And I don't know that we have that meeting scheduled yet, Katrina? Sorry about that.
We are talking about it.
Okay, great.
But I think it sounds
So,
workable.
for those of you who cannot attend the meeting on the 29th, if you could join us for the meeting on the 3rd.
What time is that?
We were talking about doing
We're
it in the
trying,
morning.
we're gonna have to check and see.
Okay, so if the rest of us can be here
You
for
don't know
the
time certain.
29th, well, you'll get it in a little while, Dawn.
This is just in time scheduling.
That's us.
Okay, so the 29th then, we do need a motion for that special meeting. Yes, Lynn?
I would till you open it for discussion. So I would.
Okay,
I move that the board approve a special meeting on Thursday, August 29th, 2013, to go before the public hearing, starting at 4:30 for the special meeting, and the public hearing then at 6 p.m., 1111 East Cedar Chavez Street, Austin, Texas.
okay, I have a motion. I have a second. Lynn?
I was just wondering if there had been any consideration, I know you said we traditionally have a public hearing meeting on Thursday at a different time than on Wednesday at 5:30. I just wondered if there had been any consideration of, rather than trying to have a cram-up meeting on Thursday, the 29th, to have two on the same week, like the 4th and the 5th, a Wednesday, a public hearing, and then a Thursday public hearing. I just wondered if you'd had that idea and then rejected it for any reason.
No, actually, Lynn, these dates were scheduled
A long
last December.
Okay,
Yeah,
okay,
so
okay.
I don't think we were even, at that point in time, we were following the patterns we'd always followed in our budget process. And of course, our budget process is not anything like we've seen before, so.
Okay. And I really don't think we're going to see, you know, the tightness in the schedule next year. I mean, it'll be
Yeah.
quite different. This is,
Sure,
you know, this is the
sure,
first year
sure.
of the CCC,
Sure.
putting together that budget, but I really do think that next year it'll be scheduled out a lot better.
I just was thinking of basically Brenda's point of giving the public as much time as possible. And the next Tuesday, or I'm sorry, next Thursday just
Week
seems
from
so
tomorrow.
close. That's all. Thinking that you all might profit by having one more week under your belt to be able to do it.
Mhm.
Yeah.
If we're far along on this road, we'll stay on the road.
Well, we're happy also to post the presentation that Jeff gave this evening onto the website in the same location where we, you know, in a location that makes sense for folks to find if they're looking for the public hearing information. So we'll just keep adding to that. That's something that we can do.
Frankly, it is only really a meaningful presentation with Jeff walking you through it. I think
Yeah.
it'd be very hard for anybody in the public to try and piecemeal and
Okay.
understand that. I would have had a hard time.
Okay, any other comments? Okay, all in favor, signify by saying aye.
Aye.
Any opposed? Okay, thank you.